Hi everyone, it's Hannah Boyd from New Leaf Naturopathic Health, and today I'm going to have a really lovely conversation with one of our New Leaf practitioners, Jacintha. She is a incredibly experienced fertility and pregnancy support naturopath with 20 years of experience doing this work, and we're very lucky and grateful to have her as part of the New Leaf family working together with our patients. So hi Jack, thanks for taking the time for having a chat.
Hannah, thank you so much for having me. I don't know if you just heard that. That's the puppy in the background.
I love a puppy in the background. It's the best
Good.
thing
That's real
about
life.
it is. It's my favorite thing about telehealth is when you see the cats and the dogs and the babies. It's,
I
it's one
love
of
it
the.
too.
Sometimes you get cats from all angles when they're walking in front of the camera, but that's
Yes. Walking over the screen.
exactly.
Yeah.
But I love that about telehealth. I think it just makes it much easier. I'm here for the babies and the fur babies all the
I am
time.
too. And seeing the kitchen and the dining room and the bedroom and the pantry because invariably they're going in to get, yeah, right, that's the protein powder I'm taking. Or yes, I am taking a fancy pants mushroom latte. This is the one.
I know, it just makes it really easy. They don't have to email you after the appointment and saying, this is what I've got. Everything's there. That is one of the
Yeah.
many benefits of telehealth, I think. And also, you get to stay at home and look after your puppy, which
Yeah. And
is
I'm wearing
great.
no pants right now. That's a joke.
We're all picturing that right now. I'm, I'm just not wearing any shoes, but I am wearing pants. So that's okay. So, Jack, I mean, you've been working in fertility for a really long time and you've helped so many people start their families. If there was one thing that you, or two or three things that you've seen over the years that you would want every patient that's starting this journey to know, what would it be?
Okay, the one thing I would suggest is understand your menstrual cycle. The number of times people are coming to see me and they've been timing intercourse at completely the wrong time because they don't understand where ovulation is occurring is huge. Those apps that we use on our phones are really a guide only and nothing more than that. They aren't really great at pinpointing where ovulation is occurring unless you've got a regular bangs smack on 28-day cycle, which not Hannah, you'll know, not many of us do.
No, and that's what I find so funny when you ask a woman about her menstrual cycle. They'll say, "Oh, it's normal." And my answer
Yeah.
is there is no such thing as a normal menstrual
Yeah.
cycle. Every woman or person is individual and different. So, and those apps, they just try and the algorithm tries to fit
Yeah.
you in a normal picture. What the world loves is trying to put women in graphs and fit them into boxes. And
Totally.
and I think working in fertility and women's health and hormone health, we know that that's just impossible sometimes.
It's impossible. And so I think number one, if you're trying to conceive, understand your menstrual cycle and seek help when you need to learn more about it. But also that thing you just said about everyone loves to put women in boxes and on graphs. And the thing is, fertility is not just a female issue. Can I make that the second thing we want everyone to know?
Yes, yes.
Like, I honestly want to put it on a t-shirt
And a
because,
mug and a t-shirt
yes,
and a bumper
absolutely.
sticker.
Yeah,
Yeah.
because I think that in the fertility space, it's not just the tests that are done on women. I don't want to use the word blame, but I will. The blame that is shifted on the responsibility, it's the mental space, the mental load, it's all on women. And actually, the number of times, because I'm very couple focused in my treatment, the number of times where there is significant male factor fertility issues is far more common than anyone would think. So, yes,
Male factor.
infertility is not just a female issue.
It is not just a female issue, 100%. And I think there is so much that you can do or we can do as naturopaths and nutritionists and herbal medicine practitioners to support couples and individuals through pregnancy journeys. What are the, often, a person's trying to start a family, they go to the doctor, they have some tests to make sure that they're not carrying any, strange diseases, and then they're told to take some folate and some iodine and off they go. If you could speak to those people at that point, what is naturopathic support during that fertility journey going to offer them? What is the journey that you take them on different from that? And why do you think couples and individuals starting families need more than just those few screening tests from the GP and some folic acid?
Yeah, because one, I don't think they're enough. I don't think that's enough. we are in a bit of a infertility epidemic. I mean, that's super clickbait. But when you see another graph, but this time about male fertility, that sperm counts are declining and have been 1% per year, I think, since 1970. We are in a little bit of a subfertility epidemic, and I don't think it's enough, usually, for just baseline screening and a baseline preconception multi. And on that, that baseline preconception multi that's going to be suggested to them is not that comprehensive. We all know the one. It's sitting front of centre at the chemist. It's not that comprehensive. And I think people can do better. And also, everybody's story is different. The fertility support required by a 27-year-old woman compared to a 43-year-old woman, or the person with endo compared to the person with PCOS, or the person who's trying for their second child. You know, like 1 in 10 people have difficulties conceiving their second child, and it doesn't really get talked about that much.
Exactly.
So there's space for a little bit of a more comprehensive and thorough scaffolding, and I think that's where naturopathic support comes in.
Because at its, very best, naturopathic medicine is individualized healthcare, 100%. And that's what, I love about my practice. You love about your practice is that one person sitting in front of you and the support that you give them is very different from the next. It's not
Completely.
that cookie cutter, like, watch this quick webinar and buy this list of supplements that everybody needs to take for
Yeah.
their fertility. It's like, what
Yeah.
does that one person need right now?
Yeah.
That's what I love about the work, which is why we spend a little bit more time with our patients than
Yeah, you know
others.
what we do, and I think that is a distinction. We do spend a great deal of time with our patients, and the number of times I'm sure both of us have heard, whether it's a fertility patient or somebody else, the time they spend with us and the information they learn from us is often more than what they're getting from their GP or their fertility specialist or their endocrinologist, because we do have the luxury and the space of time, and we are treating everybody as an individual.
And I just got an email this morning from a patient I saw yesterday who just said, "Oh, thank you. I just feel so validated in my experience." And that is something that I hear all the time, because giving people that time to tell their story, understand their health conditions with curiosity and kindness, not blame, as you say, is often laid particularly on fertility journeys. It's just such a huge part of what we can do as naturopaths to help people. So as you said, everyone's fertility journey is individual. There's not one the same. And so how do you help this patient? Like, if you were speaking to someone coming along wanting to know how you can help them, how would you do it?
Okay, that's a big question. That's a very big question, Hannah. How would I do it? I would suggest that, as you just said, everybody's story is different, and I want to know more. I want to ask more questions. I want to understand every single thing there is to know about somebody's menstrual cycle. I want to understand and explain to them that your IVF specialist might be very interested, and for good reason, in your FSH and your AMH. But to me, you are more than that. And I want to understand where your fertility is sitting in the context of your overall health, because that's really where we're going to get the better outcomes. When we understand how your fertility is sitting within the context of your full body health and your home life, your work life, your environmental exposures, and this is again where we've got the luxury of time and space to inquire about this compared to maybe another specialist.
Yeah, it sounds like a no-brainer when you put it that way, right? Because hormones on paper mean one thing, but looking at them in the body, in the environment they're in, which is what naturopathic medicine does so well. So one of the things that I often say to my patients is, when they start having on their journey to starting a family, is when women spend their whole life trying not to get pregnant, and when the time comes for them to start having a family or wanting to have a family, they think that they can't, even before they've started trying. What do you say to women in that situation where they feel like their body's going to fail them, even before they've got? This could get very political, because the raging feminist in me goes, well, let's rewind and why I think why women have no faith in their bodies. But
Yeah.
do you hear that a lot as well from your
Yeah.
patients?
I was wondering if this would head towards, when you started this, any discussion on medical misogyny there. Yeah, I mean, but I think that's a really valid point. I think the number of times that you and I have probably sat in front of somebody who has experienced years and years and years of pain, for instance, during their periods, and been completely dismissed. Of course, they think this is in their head, or I know something's wrong, but no one is taking me seriously. And so it does build up this seed of doubt that maybe this won't work for me. Maybe I won't have children. I do think it's bigger than that as well. I think a lot of us are now waiting till we're older to conceive, and we do know that it is more difficult to conceive when you're older. Egg quality declines, sperm quality declines. So I think it's bigger than that as well. But also there is a lot of noise in this space. You know, there's a lot of noise. We know that 1 in 10 women have PCOS, 1 in 9 have endo, 1 in 6 individuals experience infertility, 1 in 4 of us will experience miscarriage. You know, that's all out there. There's the egg timer test. Oh my God, what's my ovarian reserve? How much time do I have left? There's a lot of noise out there. And I think that also plants the seed of doubt that maybe this isn't going to be an easy journey. And you know what, Hannah, to be honest, that's actually a really difficult tightrope that I walk down as a practitioner, because I know those stats, and I know for a lot of people it actually isn't an easy journey. And so how do you balance that knowledge with also trying to, you know, you and I are inherently optimistic and positive practitioners. We are, you know, that's our nature.
And I think also the ethos of New Leaf is to not drive through fear.
Yeah, that's
but,
right.
I mean, it's really important that, you know, when we talk about what we can do, we don't come from that place of you will fail, that's why you need us, you know.
That's exactly right.
I think that that's super important. Strong feeling that I have in building this space for our patients is one of, you know, support and scaffolding, not fear and you know, constant worry that things aren't going to work out. And I think
hope and positivity. And I definitely think my patients walk out of every single consultation, I feel so certain of this, feeling like I am their cheer squad. Like I am 100% there for the good, the bad, the ugly, but ultimately for hope, for positivity, to enter every new project with a sense of optimism. And I am 100% their cheer squad. And I really think that's important.
100%. I agree. And you can't really, how do you sort of talk about the benefit of that if you've never experienced it for patients, you know? And I think that that's the thing, when people start seeing a naturopath for the first time, they go, oh, I feel like someone's on my team, you know? The amount of people that you've helped and that I've helped over the years be able to learn how to advocate for themselves in the health space, learn how to talk to their health professionals in a way that they feel confident in asking for things, you know, advocate for their choices during pregnancy and postpartum. I mean, it's an amazing relationship that we have with our patients that I love. I mean, it's what I love about my job. So.
And that's why, you know, I've been in practice for 20 years. You've been in practice for a long time as well. It is why we end up seeing people for their first baby, their second baby, their third baby. I have patients now who conceived their children with me 20 years ago, who are now sending their daughters to me to learn about their menstrual cycle. I mean, that's like, I have goosebumps when I say that. You know, we are so lucky to be able to form those sorts of relationships with our patients.
Yeah, I agree. It's an honour and a privilege to see people through so many different cycles of their life and their health. And, you know, when a patient comes back after not seeing them for a while, and we get a lot of repeat patients over years at New Leaf, and I go, oh, I'm so glad to see them, you know, because I do remember a lot about my patients, you know, that's just part of what I love to do. But then I also go, oh, I hope they're okay.
Yeah, that's right.
I hope everything's okay, you know, why they're coming back. And people come back, you know, because they just like, I just need to check in with you because this is happening, and you give me sensible advice. You know, you give me that kind understanding. And I think offering our patients that at New Leaf is just, it's important. Yeah, I love the work and the space that we create for people. So, we didn't get too political on that one, which is good. But
Yeah.
we could have. Maybe in the next video we can talk about medical misogyny. Let's go.
Can't wait.
So, I guess there's a couple of conditions when it comes to fertility journeys that people kind of automatically assume, that they're told that this is not, it's going to be a difficult journey for them, right? And so one of them is PCOS. And I constantly hear patients get diagnosed with PCOS, whether it is really PCOS or not, needs to be examined when they're 16, 20, 21, and they're holding on to that pattern and that diagnosis until they're in their 30s or late 20s, thinking, I've got PCOS, I can't even get pregnant. What do you think about that condition? How do you help approach a PCOS patient?
Yes, and so what you've said there is so important. It's such a fluid condition, really, and it does come back to that thing, if you are not your diagnosis. So with PCOS, fundamentally, you need to be ovulating to conceive. So if someone is an ovular, that we need to address that. So we need to restore a regular ovulatory pattern, and whether that's us doing it or working alongside conventional medicine to do that. And that's another thing that's really important to remember, and maybe we can come back to it later, Hannah, is how beautifully naturopathy works in sync with orthodox medicine. Like, people should not be afraid of combining the two when you are seeing a qualified practitioner who understands risk versus benefit and herb drug interactions and is sensible enough to look for them. Anyway, another topic. Park that one.
Put that one on the list for next time.
Put that on the list for next time. PCOS, we need to restore a regular ovulatory pattern or support any medication that is doing so. And then we need to look at, when we're supporting a person's journey through fertility with PCOS, we need to be working on optimizing that follicle maturation. That's really where things start to become a little bit compromised. The follicles aren't potentially maturing in the most optimal way, which yields potentially not the best quality egg for us to use and utilize. There is some research showing that the eggs of PCOS women don't become as good a quality as another woman and don't go on to create as good an embryo. So those are things that are going on in the background that we can manipulate and we can target. So for me, if someone comes with PCOS, I'm certainly not thinking, holy moly, this patient's never going to have their babies. I'm definitely not thinking that at all.
Yeah, no, me either.
No.
Me either. That's true. I mean, we could, talking about PCOS diagnosis is a whole other thing. But I guess when it comes to endometriosis, which is another big topic of infertility issues, I mean, often I've seen patients that are starting their fertility journeys and didn't know they had endometriosis.
That's right.
And it's through that process that we're getting diagnosis as well, and treatment and support, which can look like many things these days for endometriosis. But I know with the work with all the endo girls that I love supporting, naturopathic treatments like, nutrition, lifestyle, and a holistic approach to their care really does make a difference. So, a lot of, women are told, go and have a baby, you got endometriosis, that'll fix it, or don't even bother trying, just come straight
right.
see a fertility specialist. How do you navigate that with patients, that landscape with that kind of real fear when women have actually, they had surgeries, they've had detailed ultrasounds, they know really what's going on. What's your message to those women?
So my take out from that is that if that's the position someone's in, they are now literally in the very best position to start. I don't love the scaremongering. It's not helpful. And ultimately, again, as naturopathic practitioners, if we can look at that background picture of endo, if we can look at and address the background inflammation, the background need for extra antioxidant support for immune system regulation, for, structure versus function. Sometimes we need a manual therapy in there, like a pelvic floor physio, or sometimes we need that as well. So again, that is, let's embrace who we are and what we are. None of us are perfect, and support that, put the scaffolding in place to get the best outcomes in a natural conception cycle or an IVF conception cycle.
And so, I mean, with that fear, when younger women are getting diagnosed with these conditions, they're like, okay, or not, or perfectly, no issues with their menstrual cycle. They're going, all right, I'm going to get to egg freezing because that's what Instagram's telling me to do. What do you, what do you think about egg freezing? Do you have a,
Yeah.
yeah,
I love it. I love it. I love that it's available, but again, because it is out there a lot and everyone's talking about it, you do need to look at it with a bit of a balanced approach. If you are looking at freezing your eggs at 42, they're not going to be top-notch, amazing quality. Definitely see someone to optimize your eggs before that. But the other thing is, when you look at the research, the number of women that go back to use their eggs is actually very small.
very low. Yeah, it's,
Very small number of women.
I think it's, the last study I saw, I think it was like 15% of women who collect their eggs don't go on to use them because they fall pregnant
That's
naturally.
exactly right. Or they meet a partner down the track and then, so I think that's something to be really mindful of, that you may not go back and use their eggs. And for some, I've had actually a number of women say to me, I don't care if I don't go back. I
Yeah,
need
I
to
just
feel
need the
square now.
security. Yeah, I
Yeah,
want that security.
I
And I
need to
think
feel square now.
the options to have it are there are more, and I think some of those clinics that are offering it are doing good education around that as well. I think understanding, women I speak to about it, they don't necessarily understand that what they're going to be put through is a full IVF cycle for that to happen. And I think naturopathic treatments alongside that can really mitigate some of those negative effects that we do see long term from
Yeah.
IVF cycles.
And even on top of that, seeing a naturopath beforehand to try to optimize the quality of those eggs. Like
Oh my God,
that's,
100%.
yeah, I think that's where we also have a really important role to play. And making sure that women understand that I think how many you need, like 20 frozen eggs to have a 60% chance of a live birth. That's usually more than one stimulated cycle. So there really does need to be a sense of realism around egg freezing. It's pretty costly unless you qualify for government support for that. Um, but ultimately, I'm a massive fan of taking control of your fertility. And if that involves egg freezing, then I'm certainly here to help book in that 3 months of preconception care. Let's work on that egg quality.
Exactly. I mean, it is. It's you need to go through the process like as if you were about to fall pregnant in 3 months. And I
Yes.
think that, knowing that kind of helps people with better chances. And we've seen it in our patients. They've had some IVF cycles and they haven't done great. And then you put them through some supported naturopathic care, and the egg quality and the number of eggs improve.
And the sperm quality and
Sperm.
the fertilization rate and pregnancy.
Yeah.
Yeah.
We see it. So
Yeah. But the thing is, it's not magic. Like
no.
preconception healthcare now, back in the day, like 20 years ago, maybe it wasn't such a big buzzword as it is now. But I mean, a few years ago, the Lancet had a preconception issue. Preconception care is very well researched and evidence-based.
Yeah, and it's not about being fearful or worried about it. It's actually about passing on genetic information, because genes we can change a lot about the environment they live in, and we know that you can pass on so much information from male or female contributions to future generations. I mean, you kind of lose the starry-eyedness, amazingness of thinking about, as you say, the kids that they're coming to see you in your clinic. You help create them. But I mean, the parents did a lot of the hard work. So. There's a really important understanding of that generational health that we can pass
Yeah.
on. So it's really fabulous. So if someone was thinking about having a baby in the next year or two, what would you tell them to do?
I would tell them to get to know their cycle. Definitely. I would suggest they go to see their GP. I would suggest get on top of your overall health. Your overall health affects your fertility. If you've got niggling toothaches, gum disease, the oral microbiome affects placentation and placental health. Get on top of it well before. you're ready to start. I think we all really need to learn to be very proactive about our health at any stage. If you've got bacterial vaginosis, get on top of it. The vaginal microbiome is so important for fertility outcomes. HPV. If you're on medication, see your GP to make sure your medication is right for you now. How might it change when you start trying to conceive? I think take full advantage of the care that GPs can offer. Take full advantage of the care a naturopath can offer for us to discuss, are there any underlying factors that might affect your fertility? Can we start working now on eating 5 vegetables a day to
Or
improve?
more, as I say.
Or more.
There's no limit for my patients. I say you
Gosh.
cannot eat enough vegetables. That
Can I
is,
just say, I love that so much because I say all the time, eat a minimum of 5 serves of vegetables a day, but I never add, but there is no limit.
there is no limit to
There's no
vegetables.
limit.
No, this, you don't
love
have to be a
that.
vegetarian to have no limit to the vegetables you can eat. I think that's, men eating those veggies. Seriously, that's very important.
Very so important.
100%. Oh, that's good. That's very sound advice. And those patients that we get that turn up and say, I'm thinking of having a baby next year, so I just thought I'd, make sure that everything's good now. I mean, those patients just make me go, oh yeah, we're gonna be great. This is gonna be fabulous. We're
Me
gonna
too. I
help this
love that.
person. They're gonna understand their body. By the time it comes for them to conceive, they're going to
Yeah.
understand their cycle in such beautiful detail. And when they come back and they start talking about, and so this month, I noticed my temperature. They get it, and you're just
They
like,
get
oh,
it.
they've listened and they understood, and we've helped explain that to them, so they feel really empowered to.
And knowledge is power. And I think also sometimes, as you all know from your practice as well, the first time anyone really asks a woman detailed questions about her menstrual cycle is with us. And it is empowering to think, wow, the number of days I bleed for, or how heavy it is, or the pain I experience is significant and important.
Oh, it's normal. Okay, and let's ask what's your normal. I think
Yeah,
your
that's
normal
right.
is going to be different, and I think that's
Yeah.
my mum's cycle was like this, so that's why my cycle is like this. This idea of what a normal menstrual cycle
Yeah.
is needs to be debunked, I think.
Yeah,
So,
I agree.
all right, so supplements, should be taking them all the time for fertility? Is it something that you say, like if you're preconception, can they be choosing them on their own? I mean, the fertility preconception multi-space out there is very full of shiny marketing and stuff.
Yeah.
What's the best advice you can give someone if they're thinking of having a baby, if they're wanting to prepare for that when it comes to prenatal multis? And does everyone need a prenatal multi?
Yeah, I am a big fan of supplementation during preconception care, during your fertility journey. I think quality matters. I love it when people are taking supplements, but I get a bit sad when they're spending a huge amount of money on something that's substandard, that they've bought without knowing that it's substandard, or they're taking a suboptimal dose. I read that inositol is great. Yeah, it is. When you're taking the right dosage, you're taking, things like that drive me a little batty.
Yeah. And that's the evidence-based practice, the
Yeah.
evidence-based practice with heart, I think that's the beauty of naturopathic medicine, because you know exactly how much of that nutrient they're going to need to see that impact, because the studies are really clear on what we should be doing with those things. So 100%. So check your multi, talk to a naturopath before
Check your
getting
multi, talk to a
Instagram.
naturopath. Yeah, and that's the other thing I think I would love to make everyone aware of with naturopathic support for fertility. It's not gimmicky. This is not gimmicky. This is not about those fancy mushroom lattes. This is not about we're going to get everyone on lion's mane. There's real evidence around the support and the treatments that we offer, and it's way more than a fad. It's way more than what the influencers are saying.
100%. Thank you. Thanks, Jack, for your time today. Any parting messages to people out there thinking about seeing you or naturopath for fertility or pregnancy care?
Oh no, just come on down. I'd love to meet you. I'm sure we'll laugh a lot and learn a lot together.
Yeah, great. Thank you. Thanks, Jack. We'll have another conversation about other things another time down the track. I'm sure of it. So speak to you later. Thank you.
Sounds lovely. Thank you, Hannah.